the quality introduction to OcuSci as well as the MGrx treatment. If you haven't seen the video that we already have on dryrescue.com, where we're actually demonstrating the ins and outs of the unit, I just wanted to show it off for you real quick before we got started. So on the initial video that you saw, we have a couple different pieces to the unit itself. The first is the actual handpiece. So the handpiece itself, you can tell I'm not a very large person. It fits smaller than the size of my hand. It's really easy and light and weight to be able to take care of. It turns on and off very simply, and it has a very easy to use interface that's right on the front of the device. The attachment pieces are housed in a pre-warming device that we can see right over here. I'm actually going to take it off for just a moment. This pre-warming device actually warms up the attachment pieces to the proper temperature to do the procedure so that the device itself doesn't have to waste a lot of battery power to continue throughout the procedure time. So I technically like to keep my device right around 50 degrees Celsius so that it is just about at the level to be able to do a nice warm debridement and warm expression of the glands. And that was one of those things that's unique about the MGrx. If you hadn't noticed, it is cleaning, it's warming, and it's expressing. But all the steps in those procedures are all being warmed continuously. So we're actually getting a heated debridement, a heated massage, and a heated expression all the way through to keep that meibum liquid. If you don't know, the meibum itself, once you heat it up to the proper temperature to be expressed, actually cools back down to its thick, inspissated type of consistency after anywhere from 2 to 10 minutes. And most people, it's 2 to 5 minutes or so. So we have a limited window in being able to express everything that we need to out, or else we're just going to leave the clogs right in there. And MGrx solves that problem by allowing us a little bit more freedom and time to be able to work with. So we're going to get started today with a patient who is a friend of mine and has graciously donated her eyes to be able to be part of the procedure for us. And I also have my technician, Erica, here to be able to help out with the procedure. Sherry and Erica, we have you right here as well. And so we're going to walk through the basic steps of the procedure first. Essentially, it's recommended that at the beginning of the procedure, we're going to drop the patient with proparacaine. We're going to get started by giving them just a little bit of extra comfort from not having to feel the device itself, make it nice and easy to be able to perform. So if you go ahead and drop. Yeah, perfect, perfect. And while she's doing that, I'm getting the device ready. And so the device itself, when you turn it on, it has the screen up to the main loading screen here as well. If you double click on the device, if you double click on the device, what we end up seeing is actually almost like a settings logo that's on the front that's clicking back and forth with a picture of the applicator that needs to be inserted at that time. So the beginning of the procedure is always going to start with debridement. So that's going to be the first one to cycle through. Once we put it in, already warm from the device, it clocks in, we hit the button again, it beeps, and it's ready to go. If the buzzer's flashing a little bit, it just means that the device needs to continue heating up that debrider up to the proper temperature, and will take just a couple more seconds while we're getting the patient ready. So I'm going to hand the device to Erica right now while I glove up and get ready to go. So at this time, Sherry's going to be feeling pretty good from those proparacaine drops. The eyes are probably feeling nice and heavy. And I'm sorry, I can't prescribe those to you. We can only use one a day, maybe two if you're lucky. All right. So the debridement of the device is really easy. We actually don't even need to add in any extra cleansing gel like some of the other debridement devices that are on the market. Because of the heated debridement, this actually takes off the biofilm well enough just with the device itself. And so for doing the actual debridement, what I'm going to do is have Sherry look up to the ceiling for me and try and keep her eyes open as we can. The tip of the device itself is kind of like a golf club spud. And so on the outer edge of the golf club spud is going to be our sharp surface to do some of the debridement. It's not too sharp where we're at risk of cutting or damaging the epithelium, but it is sharp enough to be able to debride some of that bacteria. So what I'm going to have you do, Sherry, looking up to the ceiling. And as I open up, I'm slightly everting the lid and I'm just kind of brushing aside. I think Sherry's a little ticklish. That's okay. We kind of expected. It's okay. But as we kind of go through, all I'm doing is swiping back and forth, usually going one direction and then back the other. Yeah, so the beeping there is just letting them know that the device is at the proper temperature. And just cleaning off the biofilm. The reason I'm doing this, for those of you who are not aware, is because I'm clearing the caps, right? We can't really express a gland all that well that has been capped off by biofilm. All that meibum is going to be trapped inside, and it's like trying to squeeze a tube of toothpaste with the cap still on. It's not nearly as effective. And so getting the opening clear is going to be key into having her feel a little bit better. So for the upper eyelid, what I'm going to have you do, Sherry, is actually look down for me. And again, I'm going to slowly invert the lid a little bit. And I'm going to flip the device upside down so I can get to that sharper side to be able to debride the biofilm. And I'm basically just going to play a little mini golf, right? We're going to be brushing along the side, clearing the way. Okay, I'll let you blink a few times. That's okay. Perfectly fine. That's what eyelids are there for. They help us blink, all right? So, same thing. And we are cleaning all around the side. And that's really all it takes, because this is a heated debridement. It doesn't take much to actually debride off the biofilm. A couple swipes back and forth is enough to clear the caps and the openings and getting ready to go. So just for time and convenience's sake, we're going to be doing the one eye on Sherry for today. So I'm going to switch to the next step in the actual device itself. And so when switching to the next portion of the device, we double click the button on the front of the device. And it's going to go back to that logo to be able to switch to the next applicator. So Miss Erica, if you would. All right, and I'm going to trade you. We just take the tip of the device. We're going to add it right back in, click it in place, and double click one more time. When it beeps, it's getting ready to go. And to be able to start a timer for the warming that's already set into the display, we just hold the button a little bit, and it's going to start a timer that's going to beep every 30 seconds for us. Essentially, what we're doing is warming the eyelids for 30 seconds for each lid so that we can liquefy the meibum. Now, to make it a really effective warming process, I'm also going to be adding a little contact gel to the tip of the device. So for those of you who already have IPL in the office, it's kind of the same contact gel that you'd be using for that procedure. A water-based ultrasound gel is perfectly fine. What we do is put it on the tip and then massage that into the eyelids for the 30 seconds for each lid. So what I'm going to do, oh, you have some ready for us? All right, thank you so much, Miss Erica. That's why I keep her around. She keeps me on top of everything. Everyone. All right, and you don't need much. We really don't need a whole lot of gel to be able to goop up the whole area. So what I'm actually going to have you do for this, Miss Sherry, is to close your eyes for me, okay? You just keep them closed and relaxed. Now, the way that the device is shaped itself, it has a half moon shape to mask the tarsus. So you just want to make sure you're having that horizontal edge down near the lid margin as we go. So I'm doing this for about 30 seconds. Not much. It feels just like a massage, kind of a spa treatment. And you'll know that the glands are getting warm enough because the skin will start to flush a little bit. On those lighter skin patients, you'll start to see a little bit of redness accrue right along that eyelid and lid margin. That's when we're starting to get warmed up and ready. Gonna have a little bit more of the contact gel, Miss Erica. Thank you. Perfect. And then still keeping your eyes closed, Sherry. Now I'm just gonna massage the upper lid. So again, doing this for 30 seconds. It's not too much pressure in there. Yes, we're massaging a little bit. We're not trying to push the globe down like we're trying to do a scleral indentation or anything like that. This is more just to warm up that meibum that's inside the eyelids. All right. And you can see, if you can look real close, the eyelid getting a little warmer. Gets a little bit red as we go. Perfectly natural to happen. And that means we're doing a good job. All right. So once we're done, just to make sure that none of the contact gel gets in the eyes, at this point, I normally have a technician come by and actually clean off the contact gel a little bit before we do the expression. So I'm going to have Miss Erica do that for us while I switch to the next phase of the device. Okay, thank you, Miss Erica. All right, you can come on through. So while the mybome is nice and warm, I'm going to start with the expression. Now with the expression, we want to make sure that the red part is the part that's heated, is the part that's going on the outside. This is an external heating and expression that we do throughout the procedure. And for this, Ms. Sherry, what I'm going to have you do is open up and look towards the ceiling. Now, my technique for expression may be slightly different than yours, but what I like to do is do 3 different zones, temporal, central, and nasal for each lid. And I try to go from bottom to top in each expression, just to make sure that I'm getting the most out of my expression as we go. So if you would, look up to the ceiling here. And as I pull down, I can even feel through the gloves, her skin's nice and warm. And I'll just do a gentle squeeze. 1, 2, and 3. Okay, same thing. I'll do it for the central a little bit. 1, 2, and 3 here. So she's got nice clear mybome. She's been taking her omegas and she's been doing a great job. Probably not as easy to view on the video, but I'm happy to see that in one of my favorite patients. Same thing here. 1, 2, 3. Yep, and just making sure that we're getting all those zones for each side. Same thing for the upper lid. Now what I'm going to have you do, Miss Sherry, is look down for me. And as we go, 1, 2, 3. Okay, blink a few times. Same thing, still looking down. I'm going to come in the center part. 1, 2, 3. And same thing, one more time. 1, 2, and 3. And that's about it. So in that amount of time, yes, we only did one eye, but in probably 3.5 to 4 minutes, we'd completed one eye, maybe add in an extra 90 seconds to 2 minutes to be able to do the other eye as well if we're going back and forth in between the two. But within 5 to 7 minutes, we've got a lid cleaning and lid debridement technique all put in one. Thank you so much, Sherry, for being a part of it. I'm going to go back over here. Thank you, Miss Erica. I'm going to give you that back to put on the charger. So overall, as you can see, the MGrx has not really been an impediment to our workflow at all. This is something that can be done in between patients. I can have somebody set up in a separate exam room, ready to go for debridement and warming, and then jump back into the next exam. I can schedule their own time slot so that we can talk through it a little bit more if I know a patient needs a little coaching to be comfortable with a procedure here in the office. It allows a lot of flexibility within our office, also with a very small footprint. It's not as obtrusive as some of the other devices that are there, and allows us to have a lot of freedom and flexibility. Let's see. I think, David, hopefully I hit a bunch of the different points for us, but I wanted to toss it back over to you, see if there are any other points or questions that have arisen that I can help answer.
Yeah, I just want to point out a couple things. The chat room's been pretty active, so I've been answering a few things on there. But let me just bring up a couple of things that I think are common questions. And by the way, thank you very much. Excellent presentation. And I mean, it really is pretty simple. I think we in-serviced you over Zoom in 10 minutes, and you were off and running, and that's pretty much the experience. So a couple of things. One, you pointed out, but let me just reemphasize, the preheater, the black, round mass there, the only purpose of the preheater is to save you time and battery. So the MGrx, the actual handheld device, got one here, can do the whole thing. And that's how we started actually, but you end up sitting there for 3 minutes waiting for the device to heat up these instruments from room temperature, which might be 68, to 110. And that's not a lot of fun for anybody. So that's why we came up with the preheater. But just to be clear, the preheater at 50, which is the right temperature, by the time you move that instrument into the MGrx, it's lost 5 degrees by the time you've moved it and set the instrument to heating. So there is actually a sensor in the tip of the MGrx that is testing temperature 1,000 times a second, and powering up that heater up and down to lock in the actual temperature. So anyway, just to be clear, the preheater is just there for efficiency, both for your workflow and for the battery. I think one of the other questions was, or one thing I wanted to point out, the expression, you'll note that the patient was not squirming in the chair, unlike with, kind of handheld expressors. The expressor is pressure limited to just 12 psi. So it's not a lot of pressure on that eyelid, and the device is designed so that you can't put more pressure than that. So a regular handheld expressor, it can put out 40 psi. So if you've ever used a cold expressor, it's a completely different situation. Yeah.
That's true.
Yeah.
Yeah. No, and just reiterating your point about the workflow and the preheater, the device itself. There's been times in our office that I've forgotten to put the handheld portion back on the charger, and I may have only gotten 3 or 4 treatments in when it's completely left onto battery alone, and then just heating up the actual the tips to the device itself. So that has been pretty key because the stand and the charger, it's a USB micro charger that's there, are not really too uncommon, and we can have them in each of the exam rooms. That made it just really nice and easy for us to be able to go back and forth and just pick it up as needed. Especially if you have a full day that's going to have multiple lid debridements on, you don't want to be stuck waiting for the device to recharge. But overall, if you are packing them in together, 3 or 4 right in a row, you should still be able to accommodate that, no problem.
Yeah, no, that's a great point, Dr. Beck. So it is you can use a USB charger on it. And one of the tips, so on a full charge, you can do, without putting it back on a charger, you can do 2 patients, maybe 3 if you're really efficient. One of the tips is you can actually plug in the device during massage, because you don't need fine motor control and closed eyelid, and that will save your battery. It won't really recharge it, but it'll save it from going down any further because that's using the most battery. So so that's a good point. And then there was a question, Dr. Beck, some compliments on your presentation, which I agree wholeheartedly. But some questions about, could you address when you use this versus other thermal treatments and or radio frequency?
Sure. So when it comes to MGD care, what we've learned from DEWS 2 and what we've implemented into our practice is that there's 3 main areas to target when it comes to MGD. First is inflammation, second is obstruction, and third is production. And what's nice about what the MGrx does is it really handles the obstruction portion really well. So if we think about inflammation, inflammation can be at the root of a lot of different dry eye problems, and we need to calm that down to a certain level before adding heat. I say this to my patients all the time. If you go get a bruise, the first thing that you do is not to go put a hot pack on it. It's to put a cold pack on it. But we know that heat is really good for meibomian. So we have to be careful with temperature control. So if I'm looking at a patient, for example, that has 3+ ocular rosacea and their eyelids look beater than a strawberry, then I'm not going to be jumping to the MGrx right away. The first thing I'm going to be doing is doing something to calm down the inflammation, whether it be some of the other in-office procedures that target that, or some medication that might be getting that down and under control. Once I get to a grade 2 inflammation or less, that's when I add in heat-related treatments. Then I know that we're going to be able to target that meibum without exacerbating the inflammation too much. And in addition to that, the debridement, because it's so light, it doesn't really affect the inflammation all that bad, as in comparison to like a microbuffer exfoliation or a really manual debridement. That may rough up the epithelium. This is just a gentle kind of swab back and forth with the sharpened tip, and doesn't really exacerbate things too much. When we treat the MGD in our clinic, we'll start off with a debridement, calm the inflammation, heat and express, and all the while help patients, bring up that production as we go. That was long-winded, but hopefully that helps.
Yeah, good description. And then I also related, I wanted to ask you about IPL and maybe, and I don't want to put words in your mouth, but I think you're using this in conjunction with IPL. Is that correct?
That's absolutely correct. So we kind of look at IPL as, yes, it is a little bit of heat, because if anybody of you have an IPL device or had IPL done on themselves, it does add light and heat, but it's not consistent heat that's actually being pressurized onto the meibomian glands. And what we know from studies from Dr. Korb is that the consistent heat of that proper temperature for usually about a few minutes is what's needed to be able to liquefy the meibum. Sure, it'll be a little bit hotter and a little bit more liquid than a traditional cold expression, but it's not going to be fully where we need to get it to go. Now, IPL, the intense pulse light, I look as more of an anti-inflammatory treatment. So when it comes to the gland treatments in general, I usually start there first. And with IPL and its FDA approval process, usually going through 4 sessions, usually doing a couple of sessions prior to doing something thermal. And want to get again down to that grade 2 level before actually expressing something out. And then beyond the IPL, we'll do probably around session 3 or 4 is some thermal expression, and then onwards if they need it anytime in the future. What's nice is, as David kind of had said before, is once we get thermal expression after those IPL treatments, it's usually maybe once every 6 months, once every year. And then the patients who are really compliant with their at-home care, maybe even 18 months to 2 years before ever needing a retreatment. So obviously it varies case by case, but those are the averages we're seeing.
Yeah, that's great. That's always a common question as well. And I'll just add in from all the docs that we interact with, we're finding it very common to combine the MGrx with the IPL. Like you said, first or second treatment, it really helps. They work on 2 different pathways, and it helps, kind of sell the 4 treatment package of IPL, that in the words of many of our doctors, because the patient is feeling, more immediate relief from the expression. Um,
Absolutely right.
there were some questions here about cleaning, maintenance, and I'd like to hear what you do there in your clinic, but I'll just tell everyone that the instruments themselves are just like any other surgical instrument. They can be autoclave, they can be flash sterilized, they can be cleaned with alcohol. So that's not plastic, the expressor, that's polycarbonate, so it can take 200 degrees C. So what are you doing there in your clinic, Dr. Beck?
So you're exactly right. We actually recently bought an autoclave because we started using the laser graded cornea shields for our IPL. So it's nice that this device we can actually clean within the autoclave. So it makes it nice and easy. We'll do it, the multiple times per day in between the patients and everything, just to make sure that that's sterilized and ready to go. Obviously, if something's not working with the autoclave, then we have our alcohol swabs and alcohol wipes, ready right next to it. So we're happy to do it. I think one thing that may not have been mentioned or emphasized enough about this device is one of the things I like is that there's no consumables. Those 3 tips that are on the tip of the MGrx are the same 3 tips that you're going to be using pretty much for the life of the device. And so, once you get into this and you're comfortable that you have a small amount of things that you need to be able to get started, just the handpiece, just the couple of tips that are on top of it, the warming assistance, that's really it to have a successful procedure in the office.
Yeah, no, great point. And yeah, we like to say it kind of, it's clinician directed therapy. Like you said, once you've knocked down the inflammation and you've gotten them a treatment, home care is key, right? So it's how compliant are they? Kind of the $6 million question is, well, how long does it last? And then I
Hmm.
say, well, if you don't brush your teeth, when's the next time you're going to have a cavity, right? So, but I think you're absolutely, from what you said, I agree with it. It's, depending on how severe you are and what's causing the dry eye, could be every 6 months for severe, could be annually. I've heard stories of patients who, have been seeking relief for many, many years and asked for, quarterly treatments. They just schedule them. So anyway, I think like you said, depends on the patient, but if they'll do their home care, it could be annually or even, less frequently than that.
Sure. So I just saw a question come up from one of our attendees about, in comparing this device to some of the other thermal devices that are on the market, namely TearCare or LipiFlow, and how is this a little bit different? And so what's nice about the MGRX is that it can be used really in multiple different ways. This is a nice intro because for those who have not invested in a BlephX or some of the other devices for lid exfoliation, Newlands Pro, things like that, to have something in the office, just something to be able to get the eyelids clean in a really quick and efficient manner with some heat is really nice to be able to get started. And then secondly, there have been other devices there with handheld thermal expression before. We have to rely on that for tear care. iLux is very similar in that way. And again, they all work very similarly in that regard. It's nice having it all in one device here